Hi, my name is Dr. Greg Doerr, and I was asked the question of why is it that patients who are healthy, or why should patients visit a chiropractor from the purpose of wellness? Now, interestingly enough, I really don't have more of a, what would be classically called within the chiropractic world, a maintenance practice. I'm pretty much an acute care practice, or exacerbations of chronic injuries, which we'll see with people with permanent injuries, whether it might be somebody who's had surgeries or somebody who's had degeneration or things along those lines. So I'm not necessarily a maintenance practice. Now, that being said, the way that, because I have patients ask me that all the time, like, should I come in every 2 weeks? Should I come in every month? Should I come in every 6 weeks? And my answer to them is always the same. I don't know. How do I know what it is that you need to keep yourself healthy? It's very difficult to know. There's nothing in the literature that says to us, like, you should be seeing somebody at this interval to make sure that you get less degeneration, or you won't have disc herniations, or things along those lines, or you won't sprain your ankle. We don't have anything necessarily in the literature that tells us that. However, let's just say a patient came into my office and maybe they had a carpal tunnel syndrome. And I treated them. I did my soft tissue work, I did my rehab work. I've used a lot of the taping techniques that I utilize associated with these injuries. And I've gotten to a point where I'm going to discharge my patient. Now, what I'll do is, maybe the patient was pain-free and I was seeing them once a week with their activity. What I'm going to then do is say, you know what? Let's just see how stable your injury is. We're going to give it no interventions, and other than maybe your home exercise program. And why don't you come back in 2 weeks? Patient comes back in 2 weeks, we go through the same treatment again, we test them. Patient says, you know, I've been holding up pretty well, didn't have any numbness or tingling. Great. Do me a favor, come back in 4 weeks. Let's see if you put that kind of intervention or lack of intervention into your daily routine, if all of a sudden your symptoms will start reoccurring. I'll keep pushing that out, pushing that out, pushing that out. If I find out that somebody who might be a data entry person who has carpal tunnel syndrome, and every 6 to 8 weeks, all of a sudden they start noticing that their symptoms start coming back. Maybe it's an ache, maybe it's some night pain, maybe it's some tingling, but they start noticing those symptoms are coming back. That's when I'm going to say, hey, look, it happened at 7 weeks. Do me a favor, at 6 weeks, come back in. And then we'll go through that process 2 or 3 times. Then we'll push them out again to see if they need to be in at that 6 weeks point. Maybe we'll go to 8 weeks again. And if that 7 weeks keeps showing up as that point, that's obviously when that person's activity is going to overpower the patient's ability to heal, and the repetitive strain starts taking over and the injury will start recurring. So that patient may be on a once every 7 week basis. However, what I do with my patients, if I eventually get to a point where I'm at 12 weeks, if you're not getting symptoms back from whatever activities you're doing, whether it's sports or work related, based on the injury that you initially came into my office with, I'm going to tell you right now, call me when your body starts to not feel right. Not when you have pain, not when you're injured, but when you start feeling things aren't going right. That could be you just don't feel right in your movement patterns. Your shoulder just doesn't seem to be able to slip into the sleeve of a coat as well as it did. You feel restriction more than necessarily pain. Pain may be the last thing that shows up. It's also the first thing that goes away when we do our interventions. So that's a way that I'll utilize wellness and, or for lack of a better word, maintenance care for, I like to say again, exacerbations of chronic injuries in my office, rather than saying patients should be in my office every 4 weeks or 6 weeks or 2 weeks, whatever it might be. That's, again, how I utilize wellness and or maintenance care within my practice.